Hey guys, welcome back to Facebook Live with video. We are here with Dr. Ansel Johnson, the Clinical Director of Vision Salon Eye Care Associates. Vision Salon Eye Care Associates. I've been practicing that and I was going to mess it up and I messed it up. So, Vision like it's all right. How are you today?
I'm doing wonderful.
Good.
Fantastic.
Good. Thank you for joining us.
Yes. Thank you.
So today we're going to talk about diabetes and eye wellness, eye health, because diabetes actually does affect your eye health, whether you guys know that or not. So we're going to jump right in. As always, if you have any questions, please leave them in the comment section and we'll get to them while we are on air live. Dr. Johnson, I guess before we get into, I said we jump right in, but before we get to that, can you tell us a little bit about yourself?
Sure. Well, I am an optometrist and I've been in clinical practice for about 30 years. I've been around for a while. I'm in private practice, my office, I'm the Clinical Director of Vision Salon Eye Care Associates. I'm also the Optometric Medical Director of United Eye Care Providers, which is the largest independent optometric private practice network in the state of Illinois. So I'm the medical director, so I'm responsible for bringing to our members the latest, greatest in terms of medical eye care. As an optometrist, we provide primary eye care. We're kind of like your primary eye care physician. That pretty much do everything short of surgery. So if I have someone that has a surgical need, I would send them out to a subspecialist, be it a retinal specialist, which you do a lot with poorly controlled diabetics, glaucoma, cataract specialists, although we manage those conditions. A couple other things, I've been honored and blessed to be in Black Enterprise twice as one of America's leading 101 African American doctors. Done a lot of things. One other thing we'll talk about later, I'm excited about being part of a study for eye care and diabetics with nutritional supplementation in the African American community. So been around for a while, also served on the state board of Illinois that was over licensing all the optometrists in the state of Illinois.
Awesome.
And so we oversaw all of that whole process. So been involved on administrative, board testing, clinical area of optometry for quite some time.
You sound like I'm like a busy man, so
yes.
We're lucky to have you here. Can you tell us how exactly diabetes affects the eyes?
Well, I've been doing a community outreach, community lecture series on diabetes for probably over 20 years. Mm-hmm. So we go out in the community and we talk exactly about that. So 3 main areas in which diabetes affects the eyes or vision that greatly impacts people. One is cataracts. Okay. So people that are living with diabetes tend to develop cataracts more rapidly and even at a younger age due to the fluctuation of your blood sugar levels that cause the clouding of the lens inside the eye. So when defining cataracts, cataracts is a clouding of that lens. We all have a lens behind the colored part of the eye, right behind there. And that lens, with time, it's a natural aging process, can get cloudy and hazy. And that process is accelerated. So it's an analogy to, as you get older, your hair turns more and more gray. Mm-hmm. So there's a whole continuum from just a little bit of haze to cloudiness that affects your vision. So people will complain about not only blurry vision, but glare at night or halos at night, things of that nature. So that's number one. The second thing is glaucoma. Glaucoma affects the African American community at a higher level already, but in those that are, again, living with diabetes, glaucoma is found at a higher level. And so we have to deal with that. Glaucoma is a disease that affects the nerve that travels from the back of the eyes to the brain. So that connection, that nerve is affected and it's affected by the fluid pressure in the eyes, even though you can have a normal fluid pressure inside the eye. So that nerve, that electrical signal that transmits from the eye to the brain is affected with glaucoma and is blinded. The dangerous thing about glaucoma, though, the clear vision straight ahead is the last it's affected. So what happens with glaucoma? People slowly lose their peripheral side vision over time. So it sneaks up on people. So a lot of times if I see somebody that hasn't been in, I broke my glasses, they're 5 years old and I got to come in. And someone might have told me, yeah, I'm borderline for glaucoma, or I used to take these drops and I stopped taking the drops because they stung my eye. They may have significant vision loss or almost tunnel vision. So if you're noticing people are sneaking up on you, you've already lost that vision. And it's permanent. You can't, whatever you've lost, you cannot recover. Okay. Because that nerve is dead.
Can you stop the loss process?
You can stop it or slow it down.
Okay.
That's always the goal. The best thing, however, is always to treat glaucoma early. The earlier you can intervene and treat, and early treatment is pretty easy with eye drops. And again, having been in practice for almost 30 years, whenever we found someone that is early without any vision loss or very minimal vision loss, they do fine. The odds are 90% of one study I read that they won't have any significant vision loss the rest of their lives.
Okay.
So the key is early detection and early treatment. And there's some really nice technologies out there that help us do that. And then the third area, which a lot of people have, that people think about in terms of vision loss with diabetes, is diabetic retinopathy, which is a long word for damage to the tissues in the back of the eye. So the inside of the eyeball is hollow, and it is filled with the fluid. So people sometimes think the eyeball is being a solid organ, but it's not. It's filled with fluid. The outer layer of the inner layer of the eyeball has multiple layers to it, and it's richly innervated. It has a lot of very delicate blood vessels inside the eye. And diabetes affects those real small and large blood vessels, but it affects the blood flow throughout the body and in the eyes especially, which are very sensitive to that. And so you get bleeding, you get leakage of protein and calcium and all those other things inside the eye, and you get scarring. And that's where people have significant and a lot of times permanent vision loss from diabetes.
Okay.
And so again, that's a process you want to catch early, but it can be in some cases reversed or at least stabilized.
Okay. So how often, and Monica, if we have questions, just jump in because I see you writing. Oh.
What is keratoconus? Keratoconus is not related to diabetes. And so just real quickly, so we can get back to diabetes, keratoconus is a distortion, a lot higher distortion of the front of the eyes, the cornea, which is the front clear dome covering the eye. It's a severe distortion of that part of the eye. And a lot of times with keratoconus, regular glasses will not give you sufficient vision.
Okay.
And the best way to correct the vision with that is with contact lenses. Usually a hard lens, although there is one soft lens that is out that can help people with keratoconus.
Okay. So for normal eye checkups, how often should you be going to an optometrist?
I always recommend yearly.
Okay. Annually?
Annually, yes. Especially with children. Children are growing and they change rapidly and things of that nature. Sometimes, and that's really the discretion of the doctor. And I always emphasize to people, your eye health is what we're looking at. It doesn't mean you have to get new glasses every year, because that is generally not the case. And in our community, we think about eye care as who has the best eyeglass sale on or whatever, but it's a lot more than that, because through the process of an eye exam, we can look into and have really good insight into the overall health of that person.
Okay.
Give you an example. A lot of people suffer from dry eyes, itchy grittiness to their eyes, and that can sometimes be the very first symptom of an autoimmune disease, be it lupus or sarcoidosis, dry eyes. So that's one thing we really kind of take for granted. So just like you go for your physician for a checkup, I recommend eye health evaluation.
Okay, so how does it change for someone who has glaucoma or has diabetic retinopathy? Is it increased from there?
Yes, those people I will see more frequently, depending on how severe the case is.
Okay.
People that are showing early diabetic retinopathy or see very slight changes in the back of that, that might not be sight threatening, but it's still present, and I know it's secondary to having diabetes, I might see them a little more often. But in addition to that, not just seeing them, and what we talk about knockout diabetes is you can intervene with diabetes education. You can intervene with diet and lifestyle changes to help stabilize those conditions and even reverse them.
Okay. So let's talk about that. I kind of want to go through the phases of diabetes. So if someone is told that they are pre-diabetic or borderline diabetic, what does that mean, first of all?
Okay. Pre-diabetes means basically you're exactly what you said, you're borderline. So in other words, your blood work is showing that if you don't make any kind of lifestyle changes, or you don't change your diet or exercise, and that's what I mean by lifestyle change, you probably will convert to diabetes. It's just a matter of time. And so it's almost like being a little bit pregnant. And that's what we tell our class. And we have developed a course for managing the people that have been told that they're borderline or pre-diabetic. And 2019 we are going to be rolling that class out. So basically it goes by blood, your A1C, which is like your average blood sugar level. So A1C of 5.7 or higher, below 5.7 and 6.4 is considered what we call borderline diabetic. People with a condition called metabolic syndrome, basically their waist for men is over 40, or for women I think 35 or higher. And then your cholesterol level is around 200 or a little bit higher. Those people have metabolic syndrome, and they a lot of times are also considered borderline diabetic, or definitely at higher risk for developing diabetes. So by being borderline, it's not bad enough where your physician may prescribe for you, but I always tell my patients, okay, we got to start changing our mindset. Let's start making some changes in your lifestyle, and so that we can avoid having be put on medication, paying those co-pays, increased office visits, and all the other financial burdens that also go with having diabetes.
And I'm glad you explained it like that, because I know that, well, we know that you can be a thin person and still be pre-diabetic. So it's not always about weight or you being a certain size. It's about lifestyle.
Correct.
So you have to make those changes. So I mean, obviously it's going to be different per person, but just if you could give a quick 3 things that people should change immediately to work backwards from that pre-diabetic
Sure. Well,
diagnosis. I'm like, what's for diagnosis and what would it be?
Let me get back and I'll answer your question.
Okay.
Let me talk about diabetes. We look at the obesity trends in this country, and the increased rate of diabetes. I think the is estimated right now. The last numbers I saw was 2015, for about 9.1% of the population is living with diabetes.
Right.
It's probably higher now because again that was 3 years ago. So if we look at the obesity trends in the country, diabetes follows right behind that. So as a country, we're getting heavier, and that's really, when we talk about that's one of the biggest reasons for having diabetes. Now, so when we look at that, then 3 things. One is making some adjustments to your food intake, just decreasing the caloric intake. Real simple. Eat out of smaller plates, and that way, if you go back and get seconds, it's not so bad. But eating out of smaller plates is one thing. We just ended our 6-month diabetes education class for Knockout Diabetes, and I told our participants, I got to get you guys ready for the triple threat season of Thanksgiving, Christmas, and New Year's. That's a triple threat right there for all of us. And we tend to make this, well, yeah, we're just going to let it all out. And I used to talk like that too. But there's ways you can manage that. A good colleague of mine, Dr. Terry Mason, has always been endorsing a plant-based diet. So we should emphasize and eat more plants. So if you have a plate, you want to crowd out everything else with salads and vegetables and things that are colorful vegetables. And then maybe, the portion of the meat should be smaller part of our diet. And carbs also. Because when you think about carbs, potatoes, rice, things of that nature, you gotta watch the carbs too, because that is converted by the body into glucose, which is sugar. Okay. So increasing the plant vegetable portion of our diet. Second part is being physically active. Just moving. And when I talk about exercise, people are like, I'm allergic to exercise. I get it. But it's about moving. And nowadays we're sitting on our desks, and think about our children not moving as much as they used to. We drop our kids off.
Yeah.
We drive them, they don't walk to school. So that 20-30 minutes of walking to and from school 5 days a week, our kids are not burning those calories.
Right.
So you're taking all of those calories away. Yet now, because we're all busy trying to feed our kids, do the drive-through thing just to get them fed and keep it moving. So we have to really watch it. And so a lot of that goes into food prep. So we got to think more about preparing food for the week. I come back to food without fail, because that's 80% of the issue right now.
Right.
So activities, keeping our kids active, which drives us crazy because, you shut them there. And then for us, I'm a big believer in some sort of pedometer. We can talk about different manufacturers, be it Fitbit, or sometimes your phones will monitor your stuff. So, kind of tracking that. People say, I walk all the time at work. But you have to remember, if you're pre-diabetic and you already do a lot of walking, your body has already gotten accustomed to that level of physical activity. So some way we have to figure out how to step that up. And that can be with slight weight exercises. And again, I'm not saying going to the gym, pushing 200 pounds of bench press, but little things like that. Another fun thing I did with my class, we just did a whole session on chair exercises. So we pulled up a YouTube video. We're on Facebook Live, so utilizing that kind of technology. There's so many resources on just moving and exercise that people can kind of pull from it. And your audience is perfect for that because you can pull up YouTube and look up chair exercises.
Right. And
so they were dreading it at first, but they had said, it's not so bad. That was kind of fun. I can do that. And that's something you can do while watching TV, on the computer. There are things you can do on the computer if it's just tightening up your core muscles or sticking out your leg while you're on the computer. Yeah. So becoming more mindful of being more active.
Okay. Those are all great tips. Before, I know we have a lot of questions. So before we get to those, is one?
Yes.
Okay, go ahead.
If you are type 2 diabetic and developing cataracts, what can you do to reverse it? Is it the play?
Well, the problem with cataracts, once the cloudiness is there, there's no evidence-based studies showing that anything can reverse it right now. So basically, when cataracts are a problem, and I tell my patients, my philosophy, you're going to tell me when you're ready to have these cataracts dealt with. So someone that's sedentary, doesn't move around, might be a scene and they're at home watching TV, that cataracts might be more progressed in them than someone that's active, driving to work every day, comes home and it's night and driving and that glare just really bothers them. That person might have to have cataracts a lot earlier. So we can say 2030, 2040, whatever, but it's very individualized when that's going to happen.
So we talked about pre-diabetes and being borderline. So I want to move into people who have diabetes and what that living with diabetes and management looks like. So for someone who has already been diagnosed, what are some things, or first of all, tell us what the difference is between pre-diabetic and diabetic.
Okay. Again, someone's pre-diabetes, their A1C, which is your 3-month average blood sugar level, is 5.7 or a little higher to 6.4. That's about the range in which your doctor will tell you, okay, you're borderline. And a lot of my patients also, their physicians will have told them, well, watch your diet, get more active, lose some weight, things of that nature. And I walk this road, and I'm so passionate about it because I walk that same road. I was diagnosed with having pre-diabetes for many years, and I'm in the healthcare profession, so intellectually, I know all of the stuff you're supposed to do. But just like everyone else, you're busy. I'll get to it. I'm fitting to do this. I'm fitting to exercise. I'm fitting to lose weight.
Yeah.
That sort of thing. And then it hit me. So I'm really walking that walk with type 2 diabetes now, with all the other stuff that goes along with it. It is well controlled, but I've had my times and periods when it's going up and down. So moving from pre-diabetes to diabetes, haven't done much, and now, okay, you have the diagnosis. And it's an emotional thing. It's a lot of times it's overcoming for a lot of people. So one of the things I do want to share is that the level of depression in people that are living with diabetes is significantly higher.
Yeah.
Because you're overwhelmed. You go to your physician and they tell you, okay, I got to put you on medication. So you got to take medication. You got that's a whole nother financial thing, depending what's your insurance coverage for all of that, if you have insurance coverage. They said lose some weight, exercise, and then I'll see you in 30 days or 2 months or whatever to see, where your blood sugar is. And that's all kind of overwhelming. And you get home and you really don't do anything different. You want to. And a lot of times we hold on to taking the medication as far as controlling the diabetes. And I was just at a diabetes symposium with diabetes education, and basically there are a lot of pharmacists that was doing the lecture said medications are not, you're throwing your money away if all you're doing is taking your medication. You expect that by itself to manage your diabetes.
Right.
Taking your medication, and that's all you do, that's all we change, will not be enough to manage your medications. So I'm dealing with that one of the things I'm a real big proponent of, and I've been a member for almost 20 years, the American Association of Diabetes Educators. And I'm a member because they have really good materials that I share with my patients in terms of how to manage, how to control, and it's giving me tips on what to advise them on in terms of managing their diabetes. So studies have shown that people that have seen a diabetes educator, they do a lot better.
Okay.
Because they're equipped with information and knowledge. And it's not just information, but it's encouragement. And it's a pat on the back and, okay, we didn't do that well. And it's strategic, showing the person how to control it. And so it's not, again, it's just that knowledge and coaching. That's what Knockout Diabetes is all about, because we're the very first eye care facility that I know of in the state of Illinois that incorporates diabetes education with eye care.
Yeah. Which is important.
Yes. Yeah.
Monica? I know I saw you had another question.
Yes. What is ocular migraine?
Ocular migraines?
Yeah, is that related to diabetes?
Generally, no, I have not seen a direct correlation with ocular migraines.
Yeah.
So you have different classes of migraine headaches causing severe pain. The ocular part is where you get the visual, you get flashes of light, or you like a lot of light sensitivity. So a lot of the symptoms from your migraine are visual, eye pain, things of that nature. You might not get the headaches. This doesn't always accompany it, but it's a different, it's strictly more of your eye-related symptoms.
If you do get headaches behind the eyes, does that mean you should maybe get your eyes checked out? Does that have anything to do?
That's a good place to start. Sometimes the headaches behind the eyes can be related to sinus issues too.
So tell us more about the study that you're working on.
Okay. I am so excited about this study, the Knockout Diabetes study. And for Knockout, K is for knowledge, N is for nutritional, O is for ocular health, and C is for coaching. And so that's something we've been involved with from the very beginning. That I am one of 5 other, one of 6 African American optometrists that are really kind of self-funding this study, because we don't have a lot of studies engaged in the African American community primarily. So we are looking at people that are living with diabetes. We're incorporating eye care with some very cutting-edge technology for early detection of changes from diabetes, and not only early, but all the stages of this, which somebody has eye problems for diabetes. Incorporating that with our Knockout Diabetes education program, diabetes self-management program, and nutritional supplements that are evidence-based. Evidence-based on a small study, and we have a much larger study. Hopefully we'll double or triple the size of that study. And again, because a lot of the studies are not based on our community, we're excited because this will be a landmark study that people will talk about for many, many years and gather information about how can we help ourselves with diabetes and corporate eye care, prevent blindness, prevent visual problems. Because guess what? If we can do that, the level of people having gone kidney dialysis will decrease. The people that have amputations will be decreased, and all the other illnesses and problems that come with diabetes. What a lot of people don't realize, people that are living with diabetes is poorly controlled, most die from cardiovascular disease, so stroke and heart attacks. So those big life-changing, life-altering incidents are a big problem with having diabetes.
Why is it important for the study to be focused on the African American community?
We don't have a lot of good data, mainly on us.
Right.
And again, we've taken this, and I have to give a shout out to Dr. Paula Newsom in Charlotte, North Carolina, who's really kind of spearheaded organizing all of this. And I'm just blessed to be a part of it, but there's not a lot of good data. So will this work on us as well?
Right.
Will it not? And even in the diabetes education part, there has to be a cultural sensitivity in terms of dealing with us. And trust.
That's true.
We have trust issues when we talk about studies and these big institutions that want to do these studies. So, and that's understandable. So we are a small number of African American optometrists that are in private practice that see this every day with our patients. We said we need to put some data up there so we know what's going to work for us.
Okay. I think we have one more question, so we'll take that and then.
Are there any proteins that we should stay away from if we are pre-diabetic or already have diabetes?
Proteins.
Yes, proteins.
Or any food outside of sugar.
Outside of sugar?
Yeah.
Well, proteins right off the top of my head, I would say no, other than, you have the, your, what was I say? Actually, nothing that comes to mind in terms of proteins. I'm not a dietitian, but no protein. I always look at good carbs, looking at plant-based things, and I emphasize more on what is healthier for you. Looking at your food labels. If you can't pronounce it, it's probably not a good idea. So when you're looking at preservatives and things of that nature, another saying that we say is eat the rainbow. So in other words, your brightly colored vegetables or fruits, be it blackberries, blueberries, raspberries, green peppers, yellow peppers, green spinach, green leafy vegetables. So eating the rainbow.
I think that's another misconception too, so I'm glad you said fruits, is when a doctor says cut sugar, people think they have to cut fruit because fruit has sugar, but that's not the case, right?
It's more of a healthy cereal. But again, what we forget about too is portion control.
Right.
So it doesn't mean you eat a whole big thing of fruit, but so cantaloupe will probably have a little less sugar than some other fruits. So, and there's a lot of good resources. CaloricKing.com. CaloricKing.com is a really good resource where you can actually type up a food and see what the caloric intake is and the carbs and things of that nature. So again, your audience is very internet savvy. So there's so many there's apps that if you got to bring down and go through a drive-through, and you can look at what the calories and things of that nature are in terms of what you eat, and that has deterred me many times. I get I'm human too. I get a time of weakness, and I'm famished, and I didn't meal plan for that day, and I think about going to drive-through. Then I look at the calorie count or something, and I'm like, I just keep on keeping. Because it's not going to help.
That's a good point. So where can we find you? Where can, if people want to connect with you or Knockout Diabetes, where the
All right, for Knockout Diabetes, those that are interested in being a part of the study, we look to be starting in January. They can call my office and request that they be put on our list for the diabetes education. Not diabetes, but our Knockout Diabetes study. The number is 708-385-0013. You can also find us on the web. Our office is visionsalon.com, visionsalon.com, and then you can reach us through info@visionsalon.com, email. So that might be the best way, info@visionsalon.com. Send us a note saying you're interested in the study. We will contact you and see if you qualify.
All right. Well, thank you. Thank you for joining us.
Appreciate you.
It was great. A lot of great information. So guys, as always, if you still have questions, leave them in the comment section and we will try to answer them for you. Dr. Johnson is available. The phone number is in the comments, visionsalon.com, also in the comment section. That's it, guys. Until tomorrow, we will be back. We'll see you then. Thank you.
Thank you very much.
Bye.